All right. So welcome to BIO360 or medical physiology. I am going to be your main lab professor this semester. My name is Dr. Randall D'Souza Ordovich-Clarkson, medical doctor. You can also call me Dr. O or Dr. Clarkson. Either of those work. So for this first week, we're going to be going over the presentations remotely because this is an asynchronous week for the Monday and Tuesday lab. But in order to simplify matters, the Tuesday and Thursday labs are also going to be asynchronous for the purpose of this class, so that all the lectures are going to be covered through the Loom program through GCU. And we're going to be conducting our first actual physical in-person labs next week for week 2. But for week 1 on the Loom videos, we're going to be covering both week 1 and week 2 materials. So that's going to be general overview of the physiology lab and also the neurology lab that involves the sheep brain dissections. One thing to really keep in mind is that 90% of all the material that's going to be found in your midterm exams as well as your final exams is going to be taken directly from these lecture notes. So that's going to be very important for you to keep in mind. Also, I'm going to be offering you reviews for your midterm as well as your final, so we can go over all the material that's going to be pertinent for your exams. All right, so let's jump into it. So here's the course breakdown of what we're going to be going over throughout the entire remainder of the semester. Today we're going to be going over the introduction to physiology, but we're not going to be going over what's up here on your top right saying lab chart. Lab chart is everything that's going to be involving the tools that record and analyze the data that we're going to be collecting in lab. So that could be electrical impulses from your EEG or EMG data, as well as your EKG for your cardiovascular system. So we're not going to go over that this week, but we're going to go over that in person the following week for week 2. And for today, we're also going to go over central nervous system anatomy physiology, which is going to be pertinent to the sheep brain dissection. So we're going to go over that in the next lecture presentation that I'm going to be posting on here as well. So in terms of lab safety, for this week, you're going to have to complete your lab safety waiver as well as quiz. Important things to really keep in mind is that I expect all of you to be wearing your lab coats or scrubs during every lab. Absolutely 100% wear closed-toed shoes. And whenever we're handling anything that might be toxic, please wear gloves. We are going to be working with live rats halfway through the semester. We are going to be doing a sheep brain dissection next week. So whenever we're doing things like that, please wear gloves. I don't want you to be using cell phones in class. There's going to be one exception, and that's going to be during the sheep brain dissection, where you're allowed to take a photograph of your gross anatomical dissections, and you're going to be able to label each individual neuroanatomical region in the brain that you dissected. So that's going to be the only exception. Otherwise, please keep your phones away. And if you want to use laptops or tablets, go ahead and do so. If not, that's fine. You can use a notebook, if you will. So just some basic overall terminology. Just anatomy in general is the study of any sort of anatomical structure. Histology is going to be where you're studying the microanatomy of these anatomical structures. So for instance, you might see a cross-section on a little tiny slide that shows you all the cells that are in the anatomical section that's being looked at. And then physiology is the way in which the anatomical structures all interact in order to bring about some form of physiological outcome. So whether it's the air-gas exchange in your respiratory system, or if it is your heart pumping in your circulatory system, or if it's renal function with urinary excretion, or if it's the way in which your neurons are firing, and the study of electrical impulses. So that's going to be all lumped up in the definition of what physiology is. So some anatomical planes of dissection that are going to be very important for the purpose of this course. The first one to the top left is going to be your transverse plane. So that's going to be cutting right through the body. Coronal plane is going to be cutting through the body longitudinally, but through the side. And then sagittal, a really good way that I usually like to remember sagittal is think about Sagittarius. Sagittarius is the one who does archery, so shooting bows and arrows. And how do you shoot a bow and arrow? You hold the bow usually with your left hand, arrow with the right, and you shoot forward. So that's going to be a cross section. Up and down, forward. And then there's going to be some subsections here. So mid-sagittal, for instance, is going to be cutting directly down the midline, separating right and left equally. Then we have parasagittal, which separates both left and right, but unequally. So you can have parasagittal being off to the side here, or parasagittal on the other side there. So this is just a way for you to test yourself. You, hint, might see this on an exam where you're asked to identify what types of planes of dissection you're seeing. So the first one, remember, Sagittarius, bow and arrow facing forward. The next one is going to be cutting through laterally, so that's going to be the coronal plane. And then you have the transverse plane that cuts directly across here. Now this is a transverse section of the complete human body, going cephalocaudal, cephalo meaning head, caudal meaning down towards the tail or the toe. So there's your feet. Starting again, that's your cranial region, then into your thoracic region, and then moving down into your abdominal region, then down further into your pelvic region, and now down into your thighs, and then your lower extremities, and then down to your feet. Cool. So other orientations, remember I said cephalocaudal. You can also say cephalo as cranial, or caudal could be distally, right? So cephalo thinks cephalopods like squid, octopus, organisms that have heads. And then caudal, you can think Latin term for tail. So caudal, there's a term called Caudal Aquinas, which is the distal regions of neural fibers that come off the sacrum that innervate the lower appendages. And the Caudal Aquinas literally means the tail, horse of the tail. So cranial, also known as cephalic. Superior is above, inferior is below. Superficial is going to be closer towards the body surface. So if you could think about superficial circulatory system, you can think of like capillary beds, which are sitting superficially underneath your dermal layers. And then you can think deeper layers are going to be further into the body surface. Proximal is going to be towards the base, and then distal is going to be towards away from the base. So proximal, for instance, you could think proximal brachium, and then the antebrachium is going to be the distal portion of the arm. Or proximal could be the thigh. Distal would be towards the distal end of the lower extremity, which would be the feet. Medial is going to be anything that's in the midline, and then lateral is going to be anything that extends laterally towards the peripheries of the body. Just another way to look at it. So cranial, also known as cephalo, and then caudal, anterior, posterior, or ventral, dorsal, proximal to distal, medial to lateral, etc. And then you have your sagittal plane, which is going to be the one extending ventrally, dorsal ventral. Then you have your transverse plane, and then you have your coronal plane, both of which are, the sagittal plane as well as the coronal plane are going to be extending cranial to caudal. And then your coronal plane is going to be extending as well lateral to the other lateral portion. All right, moving on. So these are the abdominal pelvic quadrants, and there's two different ways to look at the abdomen. You can look at it as quadrants, or you can look at it in 9 different sections. So we're going to go over both. So there's going to be right upper quadrant, right upper quadrant, left upper quadrant, as well as a right lower quadrant and left lower quadrant. So in the right upper quadrant is where you're going to find your liver as well as your gallbladder. So that's going to be right over here. That's going to be liver, which kind of lies around the like the caudal region of your abdomen. And then you're going to have your gallbladder, which sits directly below the liver. So that would be inferior portion of your liver is going to be where you find your gallbladder. And then on your left upper quadrant, you're going to find your stomach, which is going to be around here. And then you're going to find your spleen, which is going to be laterally to your abdomen. So that's going to be the lateral portion of your left upper quadrant. And then your right lower quadrant, the most important organ here, just because it's clinically relevant, is going to be the appendix. For instance, if you have a patient that comes in with right lower quadrant pain and they have fever, nausea, vomiting, that's going to be very highly suspect of things like appendicitis, for instance. Left lower quadrant is going to be your sigmoid colon. So if you have things like diverticulitis, you might see a person having left lower quadrant pain. Same thing over here with right upper quadrant pain. Some of the pathognomonic conditions you might find are going to be like cholecystitis, which would be inflammation of your gallbladder, which is going to result in right upper quadrant pain, and so on. Now, if you want to get into the nitty-gritty, a little bit more detailed, then you're going to have these 9 different regions. So let's start clockwise, starting from the right hypochondriac region. Sorry, hold on a second. So over here, you have the right hypochondriac region. Then you have your epigastric region, left hypochondriac region. All right. Now you have your left lumbar region. And then moving down, you have your left inguinal region. So the inguinal region is going to be here next to kind of to your groin. Then you have your hypogastric or pubic region. And then you have your right inguinal region over here. Again, inguinal being kind of associated with your groin. Then you have your right lumbar region, and think lumbar region like lumbar spine. And then right in the center next to your umbilicus is going to be your umbilical region. And so this chart is really great in diagramming the way in which the different hypochondriac regions can be associated with different organ systems. So for instance, we talked about the right upper quadrant, but also the right hypochondriac region could be associated with the gallbladder. So remember that condition I mentioned earlier, cholecystitis, so inflammation of your gallbladder. You might be experiencing right hypochondriac region pain or right upper quadrant pain, depending on how like the level of detail you want to get into. Epigastric region is going to be associated with your stomach as well as part of your liver, because the liver extends over into your epigastric region medially, right? It can also be associated with the pancreas. And then the left hypochondriac region also going to be associated with your stomach. And then the very tip of the liver, as well as your spleen. And this is just something you can go over in more detail by yourself, but this is a great way in which that you can see how all the different regions of the abdomen can be associated with different organ systems. This is something else you might see on your test, where I'm going to ask you to name what organ might be associated with the different region, right? So think about perhaps number 7. Remember what we discussed earlier? Number 7, if you have right lower quadrant pain, patient presenting with fever, nausea, vomiting, and then right lower quadrant pain, or right iliac region pain. Right inguinal region pain, you might be thinking appendicitis. So region number 7 could be associated with the appendix. Also, the region over here on the left, where it says right lower quadrant, that could also be associated with the appendix as well. Some more medical terminology. Starting from the very top, frontal region in your head is going to be associated with your forehead. And then the cephalic or the head region can be subcategorized into cranial, which is going to be associated with the skull, or facial. And then the face can be associated, other terminology associated with the face could be the nasal or the nose region, ocular, orbital, or the eye. Otic, which would be the ears. Buccal is going to be your cheek. Cervical region is going to be your neck. Then oral, obviously, is your mouth. Mental area is going to be your chin region. And then axilla is going to be your armpit. So it's either axillary region or it's your axilla. Brachial is going to be your arm. And then antebrachial would be your forearm. And then there's antecubital, which is the front of the elbow. And then the trunk can be subdissected into the thorax or the thoracic region, abdominal, as well as umbilical region. So lower body, the antebrachial region, as I mentioned earlier. So you have the brachium, which is going to be your upper arm, and then distal from the brachium is going to be your antebrachial region, which is going to be your forearm. Carpal is going to be your wrist. Think carpal tunnel syndrome. Palmar is going to be your palm, which is pretty straightforward. Pelvic region is going to be your pelvis area. Manual is going to be hand, pretty straightforward. Inguinal region, remember we mentioned inguinal region earlier. The left as well as the right inguinal regions. So that's going to be associated with your groin. Pubic region is going to be also your pubis. And then you have your lower appendages, which would be your femoral region. Your patella, which is going to be your kneecap. Crural region. Crural is going to be the front of the leg. And then sural is going to be the back of your calf. So your lower extremity, the front is going to be crural, the back or the calf area is going to be your sural region. And then moving forward, the hallux is going to be your great toe. So hallucis or hallux are both going to be terms used to describe your toe. Pedal region is going to be your foot. Tarsals are going to be your ankles. So think about your metatarsals, which are going to be the bones that separate your calcaneal area from your digits or the phalanges. Those are going to be your tarsals that are associated with your ankle. Other terms to consider are going to be your chromion, which is going to be the top of your shoulder. So the acromial region is kind of where your clavicle connects to your brachial region or your deltoid area. Dorsal is going to be your back, dorsal versus ventral, right? Remember that. Olecranon, that's going to be the back of your elbow. So it's going to either be called the olecranon or olecranal, and that's going to be the back of your elbow. Continuing on, lumbar region is going to be the back or the loins, so lumbus or lumbar. And think about how your cervical vertebrae, your vertebral bodies are dissected into either cervical, which is going to be your neck, thoracic, which is going to be part of your thorax, lumbar, which is going to be like your lower back, and then your sacrum. So that's your vertebral bodies. So think lumbar is going to be lower back. Gluteus is obviously going to be your gluteal muscles. Popliteal region or popliteal region is going to be the back of your knee. And then we mentioned already crural versus sural. Crural is going to be the front of your shin, essentially. And then the sural is going to be your calf. So the back of the posterior aspect of your lower appendage. Calcaneal is going to be what describes your heel. So there's a calcaneal bone, and that's going to be the calcaneus. And then the calcaneal area is going to be your heel region. And then the plantar surface is going to be the sole of your foot. All right, so let's go over some of the ways in which we describe movement of muscles. So there's a couple main ways in which muscles act to move joints, right? So the main way that you can think of muscles is through flexion and extension. So flexion is where you decrease an angle of a joint, bringing the bones closer together. Extension is going to be the opposite of flexion, increasing the angle between two joints. And then if you have hyperextension, which a really good example of hyperextension is going to be your neck, which I think is right here. Yep. So you have flexion, which is bringing your head down, your chin down, touching your manubrium or your sternum. And then extension, which is moving up, straight up, okay? And then hyperextension is where you move your head tilted back. Abduction versus adduction. Abduction, I always think of like abducting an individual, right? Taking them away. So abduction, abduction, is the movement of an appendage away from the midline of the body versus adduction, which is you're adding the appendage to your body. So that's bringing the appendage towards the midline of the body. So think abduct versus adduct. And then circumduction is going to be very common in ball and socket joints. So that's going to be a combination of all these different movement patterns. So flexion versus extension, abduction versus adduction. So that's going to be called circumduction. And if you want to go deeper into the way these terminologies, you can click on this link here, but we're not going to do that for the purpose of this lecture. So again, flexion, reducing the angle of the bones, and then extension, increasing the angle of the bones. Hyperextension, you're increasing the angle over 180 degrees. Abduction versus adduction, so abduction, which is a way in which we pronounce that, because you can, they sound very similar. So you say abduction for abduct, and then just regular adduction for bringing the appendage towards the midline. Dorsiflexion is just the way in which you point your toes up if you're moving your foot up, and then you have plantar flexion. Remember, the plantar region is the the surface of the sole of your feet. So plantar flexion, bringing your toes towards the ground. Inversion is going to be turning your foot medially. So you got inversion versus eversion. Eversion is when you extend your foot laterally. And here's a good one: pronation versus supination. A really easy way to think about supination, like laying supine, which would be laying on your back or having your hands out with your palmar surface pointing up. So think about holding a bowl of soup. How do you hold a full bowl of soup? You want to have it so that the contents are being, kept within the soup bowl. So you're holding the soup bowl facing up. So that's supination versus pronation, which is you bring the surfaces towards the bottom. So if you're lying pronate on a table, for instance, that means you'd be laying basically on your stomach. If you're supinated on a bed, for instance, you'd be facing the ceiling of a room. Other movements, think about your jaw. You can either protract or retract your jaw. So protraction is going to be moving anteriorly, protraction, and then retraction is going to be retrograde, right? You're moving it posterior or into posteriorly, right? And then depression is going to be moving a body part down versus elevation, raising a body part up. So that basically summarizes all the medical terminology in terms of orientation and some basic surface anatomy and ways to describe different regions of your body. This is something that we're not going to be going over today, but we're going to be going over next week. This is your lab chart software as well as hardware, and these are the tools that we're going to be using to measure all sorts of different physiological reactions in your body. And so we're going to be going over that next week, and if you have any questions, just let me know, and we're going to go on to the next lecture.